Come on, 2, 3.
Well, good morning. Welcome back to the Broadcast Retirement Network. I'm Jeff Snyder. This is BRN AM for Wednesday, June 8th, 2022. And our top story today, what's the true cost of aging in the United States? Today's show is powered by Funding Our Future. For more information about Funding Our Future and its members, visit www.fundingourfuture.us. Well, joining me now to discuss this and a lot more, Ramsey Alwyn is the CEO and president of the National Council on Aging. Ramsey, so great to see you. Thanks so much for joining us in the program this morning. It's great to talk to you. And look, these are very difficult times for many Americans. And when I want to get into the cost of being a senior, being a person who's aging, because we're all aging. But let's start off with a basic question here. And what's the true cost of aging?
Great question. You know, so many of us don't really think about it until it's far too late, frankly, or we see a loved one maybe struggling. But the true cost of living for older adults isn't really captured by so many of the measures out there. Your typical Social Security income or retirement income doesn't actually take into account the true cost. So at the National Council on Aging, we look to the Gerontology Institute at the University of Massachusetts, Boston. They've created a tool called the Elder Index, and that really takes into account the true cost, the market basket of goods related to housing and healthcare, transportation, food, so much else, and really looks at geography as well as household composition and health status to give us a good sense of the true costs, the out-of-pocket costs of aging.
And many Americans are probably very familiar with the Consumer Price Index, and that's something that I think other groups in government use to track the basket of goods. What are some of the components within the Elder Index that are being tracked?
Well, what's great about the Elder Index is it draws upon federal and state data sets that really drill down by county to look at the real costs in ways that the Consumer Price Index does not. So, for instance, for older adults, they experience disproportionate out-of-pocket healthcare costs, whether it be Medicare premiums, copays, out-of-pocket prescription drugs, in ways that the Consumer Price Index does not. Additionally, there can be those housing costs and the variation by geography that are significant, even for those free and clear of a mortgage. That increasing property tax cost can pack a real punch. And so when you look at the Elder Index, what's powerful is it really rolls those expenses up. And on average, a couple in the U.S. wishing to age in their own home, without a mortgage needs over $56,000 annually. And when you contrast that by a typical Social Security benefit for a couple, which is about $33K, you can see how so often individuals come up short.
Yeah, and obviously that's not a good thing for a lot of reasons, which I know we're going to unpack. One of the questions I want to ask you, Ramsey, is about inflation. And I think, as I alluded to at the beginning of the conversation, a lot of us are feeling the effects of high gas prices, food prices, supply chain disruptions. What's the impact to aging? I think I have an idea, but I want to get your assessment.
Well, for older adults, the climbing inflation is really packing a hard punch because many are living on a fixed income. Actually, 1 in 4 older adults receiving Social Security rely on it for 90% of their income. And when you look at inflation climbing above 8% and you compare that to this year's cost of living adjustment on Social Security, which was just shy of 6%, the numbers don't add up. Really, inflation, the costs at the grocery store, filling up at the pump, filling the prescription at the pharmacy, they are taking a big bite out of that Social Security check.
Yeah, and that does not bode well for a lot of reasons. That economic security really negatively impacted. Let me ask you about how policymakers, you're obviously in Washington, D.C., and you interact with so many different policymakers and regulators. How can policymakers and even us as citizens kind of help make aging a better process? Because after all, like we said, we're all aging. I mean, every minute goes by, we're aging.
Well, with our first breath, we're each aging, and it's far better than the alternative, as we like to say.
Yep.
The gift of longevity really is a miracle and quite an accomplishment of our generation. But the road to poverty and the precariousness of aging without the health and economic security we all desire starts early in life. It really does. And so raising our awareness and getting a better understanding of the true costs is essential. So understanding those real costs of what Medicare does and doesn't cover, doing that advanced planning, utilizing tools like the Secure Act 1.0 and now Secure Act 2.0, hopefully bipartisan support, and we'll see that get across the finish line, could provide more opportunity, right? More opportunity for individuals to leverage employer-sponsored retirement savings plans. Secure Act 2.0 has us particularly excited by the prospect of extending employer-based savings to part-time workers. Part-time workers, often women, communities of color that don't have that vehicle right now. So the earlier you start, the more often you contribute, the better off you are. But we also have to strengthen some of the most basic social safety net. In particular, we're really advocating for expansion of home and community-based services. We saw during the pandemic how essential care work is, whether it be taking care of our children, taking care of our elders. There's no work without care work. And so we continue to advocate for Medicaid expansion of home and community-based services.
Ramsey, I need to take a very quick break. When we come back, we'll talk about the cost of chronic disease. You're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms, especially for the smaller businesses? I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network.
Are you stuck with a low credit score? A credit report and score that's causing you to be denied credit or pay higher interest rates than others for the same things? Then do what Terrence did and call Credit Repaired for your free credit evaluation to help restore your credit.
I started thinking about buying a new house, and my score wasn't where I needed it to be. I called and spoke with one of the representatives, and we just had a good conversation, and I liked what he was saying.
Just one call for his free credit evaluation was all it took to start back on the track to repairing his credit.
I'm seeing the deletions and I'm getting the report, so I know something's being done. It does make a difference to me.
All it takes is one call to get started.
Credit Repair has given me a second chance to have a better credit score.
Don't let a low credit score hold you back another day. Do what Terrence did and make the call for your free credit evaluation.
Call 800-819-4152. That's 800-819-4152. Again, 800-819-4152.
Welcome back. Today's show is powered by Funding Our Future. To learn more about Funding Our Future and its members, visit www.fundingourfuture.us. And we're going to welcome back Ramsey Alwyn. She is CEO and President of the National Council on Aging. Ramsey, thanks so much for staying with us this morning.
My pleasure. Thank you.
And you know what? I feel a couple minutes older too. What can I say? Okay, what's the correlation between health and financial security and wealth?
So where do I even start? I mean, our health is our wealth. Our wealth so often determines our health. They're absolutely intertwined. If we don't have good health, then we're less productive. We can't work as long as we want or maybe need to, and that has implications for our financial security. So if we're not financially secure, sometimes we can't take those proactive health precautions and avoid the chronic conditions that can make the whole situation far worse. So it's so interconnected, and it becomes even more acute as we age.
Yeah, I was going to ask you, how does this correlation, when we're younger, we think we're invincible. We don't think about getting older, but we do think about accumulating wealth. And I think more and more people are attuned to financial security. But how does this change as we age? Or does it change as we age?
It does change as we age. We're far more susceptible to those chronic conditions, and those have real costs. So we conducted a study recently in partnership with the University of Massachusetts, Boston, looking at the true costs of chronic conditions and really looked at it in a novel way, not just the medical treatment and those out-of-pocket healthcare costs, but also the wages and the loss of productivity that people can have as a result of cardiac conditions, cancer, dementia, other challenges. And they really pack a punch when it comes to our ability to continue to earn an income. And so we found it was staggering when you really, really examine the costs, especially when you look by gender and race and ethnicity, who's more likely to experience higher treatment costs, greater lost wages due to those chronic conditions. And of course, women and communities of color often have fewer resources to navigate these challenges as well.
Yeah, and you mentioned some of the chronic conditions. I was going to ask you to kind of tick them off, and you did. Alzheimer's, dementia. I mean, and a lot of us see it as our parents and our grandparents age. We see those things have an impact. And you mentioned some of the population that are the sickest. Are there costs associated with these chronic diseases outside of caregiving that you mentioned in the first segment?
Absolutely. I mean, the costliest chronic conditions across all Americans 60 and older, when you add together the treatment costs, the non-treatment costs, the lost wages, Alzheimer's, dementia, that clocks in at over $48,000 per person per year. Cancer, $30,000 per year. Diabetes, $20,000 per year. And then when you really drill down by race and ethnicity, you see for whites, cancer tops the list. In the just wide lens view of the cumulative costs, we found $252 billion are spent annually in terms of treatment, non-treatment, and loss of productivity. And then for Blacks, diabetes and hypertension can be extremely costly, tied to nearly $35 billion in cost. And for Hispanics and Latinos, diabetes is also highly costly, $40 billion a year.
Are there programs, look, and last week we talked about long-term care insurance and trying to make it affordable, but there's Medicare, in some cases there's Medicaid, but are there, and some of that can be covered depending on your income, that money that you have, et cetera, but are there programs designed to mitigate the impact of this? Because as we've talked about, our society is aging, not unlike other societies around the world.
So what's fascinating about chronic conditions, the vast majority of the symptoms can be mitigated in non-medical ways. Food and nutrition, exercise and diet, mindfulness, and there are evidence-based health promotion and disease prevention programs out there that Medicare and Medicaid can help individuals navigate. The unfortunate reality is most often people don't know about them, and the network of community-based organizations administering them have very modest resources to do so. So we really need to raise awareness. And at the National Council on Aging, we're proud to administer the National Resource Center on Chronic Disease Self-Management, really, really elevating those evidence-based practices and building capacity in communities to deliver those programs. And we want to make sure everyone knows about them.
Well, Ramsey, I mean, obviously a fascinating discussion and one that I think will continue. Look, I mean, we're all, as we said, we're all aging. And so we need to be made aware. Great to see you. Thanks so much for joining us. And we look forward to having you back on the program again very soon.
Thank you, Jeff. I appreciate you covering the topic. So timely and so important.
That wraps up this episode of BRN AM. Have a topic of interest, somebody you think we should talk to, drop us a line. And don't forget, for all the latest security news and lifestyle, wellness, finance, tech, so much more all in one place, check out today's edition of our daily newsletter, The Morning Pulse. Want to search our archives, check out our latest content? Well, visit our website and our streaming partners. We're back again tomorrow for another edition of BRN AM. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.
Waiting here for you to take and drink of. But if you're tired, come on.
Now is your opportunity to co-create content around any topic on the first lifestyle and wellness network. Reach a global audience through our platform and co-own exclusive branded content. All of our programs are available on demand and also as audio-only podcasts, so you can take us on the go. Broadcast Retirement Network, available anytime, anywhere, and on any device.
Are you being audited and do you owe the IRS $10,000 or more in back taxes? Is the IRS threatening to take more of your money? Don't fight the IRS alone. The Tax Doctor is here to help you negotiate your tax bill and reduce your stress. The IRS can freeze your assets and seize your bank accounts, but you can stop these IRS actions. The Tax Doctor will work with you using our years of experience to represent your case to help you get the best resolution under the IRS guidelines. Help is here to deal with the IRS to reduce your stress. We've handled thousands of cases, so we know what we're doing. If you owe $10,000 or more in back taxes, do not call the IRS alone. Call a Tax Doctor now for a tax emergency analysis.
Call 800-224-6439.